really amazing. Only a gifted person like our young engineer who's 32 years old have really got the chance, second chance in life. Thanks to the expertise of Dr. Nagmalesh, who's a lead consultant and also the director for heart failure and the transplant program. He is a person behind it who has envisaged the heart transplant program in Aster, and today it is it's a major center, the big center for heart transplant, not only at Aster CMI and Aster RV, and also we are looking at the third hospital which is there at Aster Whitefield. So,
share his thoughts on this note surgery. This procedure marked a first.
Dear, so here is something, a miracle which I would say, which happened for the first time in Karnataka and at least for the second time which has happened in India. A re-transplant of a heart. That is 3 times. The third time, 3 hearts. The second time also, a second chance is 75% is only the question of survival rate, and this is something really an amazing work done by them. I will leave the medical aspects and the difficulties to them to talk and then talk about it. But nevertheless, this I would say that we are reassuring the entire public. We are into saving life. Clinical excellence is what we believe in. That is a core pillar at Aster. So we believe that this, wherever we can save lives and ensure the transplant, especially the heart transplant program, take it to the next level. We believe that kind of, it cannot happen in every other hospital. It needs a kind of a good infrastructure to that kind of a good technology and the best of the clinician to do it. With all the 3 combination, I'm sure we should be able to excel, and that is what we are doing at Aster, and we continue to do at Aster. And Diwakar Bhatt and his colleagues who have actually put in a lot of effort. It is just not easy to just say it's a re-transplant. It is really difficult to say.
And he went through little complication post-transplant, like bleeding issues and rejection, because we have already done 1 transplant, and his immunity and the transplanted heart, and it's a second heart. So went through a lot of challenges. We were able to overcome these challenges, and now we have done biopsy, he's fine, there's no rejections, he's doing well. So this is the story of him. So it's a second chance for him to live longer, and we are trying to educate people that when there is a heart is failing, there is not an end of life. There is a chance for transplant, and if something happens over time, there is a second chance also. So this is the message should go for everybody and those who are really suffering from end-stage heart disease. Same.
I can see the ultimate love in her life. Most of the time, even among lovers, if one partner gets to know that the other person has got some disease or a major problem, they tend to go back. But this lady persisted with him. She married in the hospital, and there will be requirement of lot of bloods and products, and luckily we have an excellent blood bank which it just provides any number of blood we ask in the operation theatre. So that way it is a teamwork, it is not just one man's job. Everybody has to cooperate. Most of the time this happens in the middle of the night, and it is really amazing.
Surgery and post-operatively bleeding episodes are very high because it is done second time. We have done transplant, we are registered within 10 days and we were able to do it. Patient was 31 years with very sick. He had MI and he was not able to come out of ICU for almost 2 months. He shifted from some other hospital. So we were able to do it within 10 days because we registered him as emergency. So otherwise, regular normal waiting patients anywhere, I think they waited almost 6 months for the transplant. So anywhere between 1 month to 1 year, this is the waiting period. As far as the pig heart is concerned, it is not possible now because still it is not successful procedure at present. So it is not that you take out from the pig and you put it. It is not that way. It is a humanized heart. So there will be a lot of process to change the genetics of that pig to the human nature, and you harvest the organ. So it is not as simple as taking from the pig and putting to the humans. So that some of the companies are trying that to humanize this pig heart, but still is not successful. So they have done one heart and one kidney, but both are, they lived for a very short period. So at present it is not still a regular procedure to offer to the patients.
Dr. Divakar Bhatt, I am a cardiothoracic and vascular and heart transplant surgeon in Aster Hospital. So we are here to describe about a successful journey of a re-transplant, re-heart transplant. Heart transplant itself is a very challenging operation, and it's very rare. And Aster Group is doing a lot of operations nowadays. Last 1 year we have done nearly 17 operations, and in one of that is a re-transplant operation. This lucky person had undergone a heart transplant 8 years back, and unfortunately that got some rare disease called vasculopathy, and we had to register him for a re-transplant, and he was so lucky to get one more heart, and lucky to undergo a successful re-transplant operation, and he's in front of us, and he's a very happy man.
Sir, I'm getting, same feeling. First transplant is, I'm getting, whatever life, or quality of life. Now also I'm the feeling, same. It is, risk is there. I'm getting, quality life right now. It is, credit goes to the, my mentor and doctor is a normal sir only. And sister is a renal sister and father sister. They are also very supportive. We have to know the, normal sir and renal sister, it is, last 9 years. They are motivated more.
Is cost effective of the surgery?
Yeah, that is depending on the patient risk and everything. We can't tell that fixed.
So now how you are feeling?
Yeah, now I'm good. Everything
Back to the normal life.
back into normal life. So, yeah, working on.
You are under diet? No.
Yeah, I'm diet.
Completely. Okay, sir.